I'm a board-certified medical doctor who trained at one of the premier medical centers in the United States. I graduated first in my medical school class. I live and practice medicine by one simple principle. I treat my patients the way I would want to be treated. I'm going to explain to you today why you must take charge of your health. I've created this presentation anonymously because I seek no prestige or publicity and seek only to make you aware of the current state of healthcare in our country. I also want you to know that speaking the truth regarding this matter, as I'm about to do here, puts me at risk of not just being silenced on social media, but having my medical license threatened. We're all proud of our American freedoms, especially the freedom of speech. But unfortunately, as a physician whose sole aim is the betterment of patient care, I have no freedom of speech. Let's begin by reviewing the ideal of how medicine should be practiced. The concept of evidence-based medicine was developed as a way to teach the practice of medicine and improve medical decisions by individual doctors for individual patients. The aim was to integrate three things. 1, the experience of the healthcare provider. 2, the values and the beliefs of the patient. And 3, the best available scientific information. All three elements are equally important to the practice of good medicine, but unfortunately, all three elements have been severely compromised during the COVID-19 pandemic. Let's discuss these one at a time. The experience of the healthcare provider. Each provider's medical training and experience plays a major role in the success of his or her treatments. Healthcare providers that are well trained in herbal medicine, the therapeutic use of vitamins, what is known as orthomolecular medicine, of acupuncture, homeopathy, and other healing modalities, can achieve equally good results as compared to an approach that is based on pharmaceutical drugs alone. Since patented drugs came on the scene in the middle of the 20th century, we've seen a stronger and stronger push towards their widespread promotion by the medical institutions and the suppression of all other healing therapies. The enormous profits that patented pharmaceuticals generate under our current market system have led to widespread corruption amongst the regulators because our current system allows them to benefit directly from these profits. Now, this has been apparent for several decades, but it has become blatantly obvious during the current pandemic. The use of low-cost vitamins and patent-expired off-label medications has been actively suppressed to the point that doctors successfully using these treatments have been silenced from discussing them publicly. They've had their licenses threatened by state boards, and pharmacies have refused to fill legitimate prescriptions. Hospitals have been financially incentivized to follow only the guidelines that have been provided to them. Doctors have not been permitted to treat patients based on their own knowledge and experience, and have been forced to follow guidelines that focus on using new, experimental, and patent-protected drugs and vaccines, and this has resulted in countless unnecessary and avoidable deaths. Any physician speaking out has been accused of promoting misinformation. Open discussion and debate in medicine has been eliminated. The second foundational element of evidence-based medicine is the preferences and values of the patient. The age of the internet has brought information within easy reach for everyone. We all know that if a patient believes that a given therapy will be effective, it increases the chances of success of that therapy. This is known as the placebo effect. The opposite is also true. If the patient feels a given therapy will be harmful, it is likely that he will suffer an adverse reaction. Patients hospitalized with severe COVID-19 have suffered the most in terms of complete and total loss of medical choice and personal freedom. They've been coerced to take remdesivir and have been completely denied a trial of inexpensive and readily available vitamins and off-label patent-expired drugs. The third foundational element of evidence-based medicine is the use of the best available scientific information to guide medical decision-making. It has become blatantly obvious over the last 2 years that clinical trial data and the process of licensure of new drugs suffer from bias and conflicts of interest due to the huge financial incentives for pharma and for the regulators that stand to directly benefit. Governments, academic institutions, the media, and hospitals have all been corrupted, and this has resulted in countless unnecessary deaths. Since the onset of the pandemic, vaccine deployment and development of new patentable drugs has been the focus of our healthcare regulators. Aside from social distancing and wearing a mask and shutting down all non-essential businesses until the vaccines could be introduced, the NIH did not provide any guidelines in dealing with this novel disease. All effective early treatments were actively suppressed by healthcare authorities because if there are effective treatments for a given condition, vaccine development becomes unnecessary. Let's review who our health authorities under the Department of Health and Human Services are and the financial conflicts of interest that plague them. The FDA, or the Federal Drug Administration, the Center for Disease Control, the Health Resources and Services Administration, that improves access to healthcare services for people who are uninsured, isolated, or medically vulnerable, and the National Institutes of Health. We will begin with the NIH, the National Institutes of Health. The NIH uses taxpayer money to fund research. When that research leads to something that can be sold, NIH patents it and licenses it to drug companies. The NIH and the involved researchers get a cut. Taxpayers do not get free drugs for the money they provided to fund the research. The FDA approves drugs and vaccines. It receives 50% of its budget from drug and vaccine makers. Many physicians and other witnesses before the FDA advisory panels that evaluate drugs receive consulting fees, expense payments, or other remuneration from drug companies. Yes, the people who are deciding if a particular drug or vaccine will be approved are being paid by the makers of the very same drugs and vaccines. This is the ultimate conflict of interest. Science magazine reported that between 2013 and 2016, 40 of the 107 FDA advisors received greater than $10,000 of earnings or research support. 26 of those 40 received over $100,000, and 7 of these 26 received greater than $26 million in research or personal payments. The CDC makes drug treatment guidelines and mandatory vaccine schedules. It pays and gets money from drug and vaccine makers. The CDC creates a vaccine with taxpayer money, licenses it to a drug company, approves it, makes it mandatory, buys it for billions of tax dollars, and profits from it. This is self-dealing and is generally illegal, except in the world of vaccines. The CDC holds patents on vaccines that they approve and mandate on children. Physicians and researchers who even hold a vaccine-related patent can sit on a panel that will decide what vaccines are mandatory. The media gets money from drug and vaccine makers. Estimated pharma spending on advertising, which is mostly on TV during prime time, is greater than $10 billion. So why would they report the dangers of drugs or vaccines? It would be extremely bad for business. Politicians, both Democrats and Republican, get money from drug and vaccine makers. $40 million in donations are made to politicians. Big Pharma invests more than $233 million on lobbying annually. This is more than any other industry. The American Medical Association and the Academy of Pediatrics get money from drug and vaccine makers. The vaccine industry gives millions to the American Academy of Pediatrics for conferences, grants, medical education, and even helped build their headquarters. Pediatricians are so dependent on vaccine fees that they cannot survive financially unless they vaccinate children. This is why a lot of pediatric practices will not accept children whose parents refuse for them to be vaccinated. On this backdrop of corruption, we got hit with a novel virus and the carnage began. All possible treatments early during the course of illness were actively discouraged so that vaccines would appear to be the only answer. Doctors speaking out about possible other interventions were deplatformed and silenced, and their medical licenses threatened. I've had many YouTube videos taken down that discuss strategies to reduce the risk of illness. This violates all tenets of good medicine. To vaccinate children for whom the vaccine carries a higher risk than the disease itself makes no sense. Vaccinating pregnant women with experimental and novel technology makes no sense. One of the key things we were taught as medical students was that always be very careful with pregnant women because you do not know what the long-term outcome will be. And yet, under the current pandemic, with very little data, it has been recommended that pregnant women receive the vaccine. This table shows the 6-month trial data of the Pfizer vaccine on the basis of which the FDA granted approval. The left column lists the cause of death. The next column is the number of people in the vaccinated group who died of each of these causes. And the last column is the number of people in the placebo or the unvaccinated group that died of each of the listed causes. Please look at the 2 rows above the horizontal lines. 1 person died in the vaccine group, and 2 people died in the placebo group of COVID-19 or COVID pneumonia. Pfizer could technically claim that the vaccine is 100% improvement over placebo since the number 2 is 100% greater than the number 1. Never mind that it takes vaccinating 22,000 people to save 1 life from COVID-19, and this sort of success could never end a pandemic. Never mind that a total of 20 people died in the vaccine group versus 15 in the placebo group. So the overall effect of the vaccine was not to produce a survival benefit because there were 5 excess total deaths in the vaccine group. Yes, the vaccine was associated with more deaths from other causes than COVID-19 or COVID pneumonia. For that one life saved from COVID in the vaccine group, 5 more people died in the vaccine group from other causes. Never mind that a short 6-month trial totally fails to pick up any long-term complications that may occur. This is a slide from the FDA's Center for Biologics Evaluation and Research report dated October 22nd of 2020. This is before the vaccines were approved. The FDA anticipated this gruesome list of potential complications from the vaccines and approved them anyway. Looking at the column on the left, Guillain-Barré is a paralytic illness. That means paralysis. It means either death or a life of disability. Some patients will have improvement in function and be left with mild residuals, but many patients can have life-threatening consequences. Acute disseminated encephalomyelitis is an inflammation of the brain and the spinal cord. Transverse myelitis, again, is a paralytic illness of the spinal cord. Encephalitis, myelitis, encephalomyelitis, yes, all are inflammation of the brain and spinal cord. Seizures, stroke, narcolepsy, anaphylaxis, acute heart attack, myocarditis, you've all heard of this one, autoimmune diseases, death, thrombocytopenia, which was reported early with the death of a Florida physician within 2 weeks from this condition, disseminated intravascular coagulation, arthritis, pain, multisystem inflammatory disease in children, which is deadly, and vaccine-enhanced disease. The FDA knew that these were all potential complications, but approved the vaccines anyway. The Vaccine Adverse Events Reporting System is a voluntary reporting system of vaccine complications. Historically, it has been shown to report only about 1% of the actual vaccine complications that occur. This table details the voluntary reports of COVID vaccine complications. If we add the deaths and permanent disability numbers, we see that they total roughly 80,000. Consider that this only reflects 1% of the actual number, and the real number is likely to be about 8 million. You now see the scope of the carnage that continues to occur with the COVID vaccines. Most shocking of all is the fact that FDA anticipated all of these complications and still approved the vaccines.
Scientists are beginning to believe that a vaccine against AIDS may be impossible to make and too dangerous to test.
If you take it and then a year goes by and everybody's fine, then you say, okay, that's good. Now let's give it to 500 people. And then a year goes by and everything's fine. You say, well, then now let's give it to thousands of people. And then you find out that it takes 12 years for all hell to break loose. And then what have you done?
The approach established by the medical authorities to treat patients with COVID-19 before and during hospitalization has led to countless unnecessary deaths. Early intervention based on symptoms has been totally ignored, and patients have been told to stay home, isolate, and wait until they can't breathe anymore to come to the hospital. This makes no medical sense. So many people have died due to the combination of the Center for Medicare and Medicaid Services permitting the waivers of customary and long-standing patient rights and the CARES Act, which provides hospitals with bonus incentive payments for all things related to COVID. I will detail these for you shortly. Specifically, the Center for Medicare and Medicaid Services allowed the hospitals to violate the rights of patients or their surrogates with regard to medical record access, to have patient visitation, and to be free from seclusion under the justification of the national pandemic emergency. As exposed in audio recordings, hospital executives have admitted meeting several times a week to lower the standards of care with coordinated restrictions on visitation rights. Most COVID families are deliberately kept in the dark about what is really being done to their loved ones. The CARES Act provides incentives for the hospitals to use treatments that are dictated solely by the federal government under the auspices of the NIH. These bounties must be paid back, if not earned, by making the COVID-19 diagnosis and following the established COVID-19 protocol. Let's go through what some of these hospital payments include. Number one, a required PCR in the emergency room upon admission for every patient, with government-paid fees to the hospital. Now, this has been cut back since now most of the patients being admitted have been vaccinated, and so they do not really want to establish the COVID-19 diagnosis anymore. Added bonus payment for each positive diagnosis was provided. There was another bonus if the COVID positive patient was admitted to the hospital. Higher fees are paid for COVID-19 pneumonia, $13,000 versus $4,600. Large bonus payments are made for mechanical ventilation. That means putting a COVID patient on a ventilator pays $39,000. Contrast this with $12,000 that was paid for mechanically ventilated patients before COVID. This next one, I think, takes the cake. A 20% boost bonus payment on the entire hospital bill is provided if remdesivir was used during the hospitalization. I'm not sure how they even managed to get away with this. More money is paid to the hospitals if the cause of death is listed as COVID-19, even if the patient did not die directly of COVID-19. So if a patient died because of complications from a car accident but tested positive, many times they were listed as cause of death being COVID. A COVID diagnosis also gives extra payments to coroners. Government-dictated medical care is at its worst in our history since the federal government mandated the ineffective and dangerous treatments for COVID-19 and created financial incentives for hospitals and doctors to use only those approved and paid for approaches. The restrictions on safe and effective treatments have further magnified the death toll. Our formerly trusted medical community have effectively become bounty hunters for our life. Patients need to now take unprecedented steps to avoid going into the hospital for COVID-19 or the next pandemic. You must become informed. You must know your options. You must choose your treatment, and you must establish your right to choose, because at this point You do not have that right. Before getting sick, you must take active steps to plan to use early home-based treatments that can help save your life. You must know who the doctor is that is going to support you in case you are ill. You must take these steps before you become ill, because that puts you in a situation of extreme dependency. Einstein put it beautifully: blind belief in authority is the greatest enemy of truth. Thank you for listening.